think you all know ChI Talks is a monthly event, and together we explore facets of spirituality specifically through an interfaith lens here with the ChI community. It happens every third Tuesday at 4 p.m. If you haven't seen the previous ones, there's a whole playlist with all of the last year and a half, our sessions. We are recording today's session, so if you wish not to be on camera, I ask that you turn off your video and your image won't appear then on the recording. Greg, I think we'll have some time at the end for questions about today's topic, but you can also ask questions about the Chaplaincy Institute if you're new to us. Here at ChI, we provide education for those seeking to serve in hospitals, hospice, disasters, prisons, corporations, military, educational institutions, as activists, as in environmental contexts, as well as spiritual directors, spiritual companions. ChI is the oldest and most respected interfaith seminary in the United States. Our ordination or faith group endorsement is recognized by the Association of Professional Chaplains, the Veterans Administration, and the military. Qualifies you for Board of Chaplaincy Certification Incorporated, which is an affiliate of APC, Association of Professional Chaplains, which is the most recognized professional certification in our growing field of chaplaincy. Our clergy serve in many places: Mayo Clinic, Johns Hopkins, San Quentin, and, as I always say, in the line at the grocery store. So whether you're called to spiritual leadership or to explore interfaith in our experiential programs, we are so excited to prepare people to serve in our increasingly diverse society. And I hope to see you in our classroom soon if you're not already there. Let's take a moment and welcome Reverend Greg Cline. And thanks so much for being here with us today, Greg. I'm going to share a little bit about Greg. Greg was ordained as an interfaith chaplain and minister by us, by ChI, and received his Master of Divinity from Starr King School for the ministry in May of 2023. He is currently a chaplain resident at the California Rehabilitation Institute, an advanced trauma rehab center that was created as a joint venture between Cedars Sinai and UCLA Medical. Prior to answering his call to ministry, Greg volunteered for several organizations focused on supporting victims of trauma, from the practical, firefighter, and emergency medical technician to the emotional, volunteering with trauma support agencies, ensuring that those who are emotionally traumatized in emergency situations receive the immediate assistance they need, which we know prevents all kinds of trouble down the road. So thank you so much for being with us here today, Greg. And then before we get started, let me remind us that the divine is with us. Set our stage. I'm going to invite everybody to settle in a little bit, take a breath. And let us send healing out to the world, holding those in harm's way or struggling in love and abiding, constant, holy presence. Let us come in a little closer and hold each other in sacred love, abiding presence of all that is. And then, because this is really important, I invite you to wrap yourself in that holy, sacred love, to feel the community around you, supporting you, resourcing you. We need to stay well-resourced so that we may serve. I light our candle as I invite that divine presence to be with us in this moment here today. One more thing. I'm going to invite us to practice sliding our screens over. So you'll see Greg's PowerPoint, and you can see there's a little line in between. And if you drag that over, you'll be able to see Greg in half the screen and the slides in half the screen. That makes sense? Okay. All right. Thanks, Greg. Thanks so much for being with us here today. I'm so excited to hear what you've got to say.
Thanks for inviting me. And I do want to start out by thanking everybody for being here, those faces that I know and love well, and those faces I've never met, and those that don't have faces on the screen yet but are listening. So thank you all. And I do want to let you know, this is something that I have a couple of slides planned for us to keep me on track with my discussion, but I don't want this to be a one-way lecture. So at any point in time, as we're going through any of these conversations, even if I've not asked the question yet, please feel free to kind of jump in, and I might ask Carrie to kind of keep an eye out for hands. If I don't see them for me, just let me know if somebody's asking a question. So please be interactive. We want to make sure we're all learning together. And the topic of this conversation is trauma chaplaincy. And that name can mean a lot of things to a lot of people, as it should. And when I say it, we'll go through a little bit more of how I define this later on, but really what I'm looking at here is simply, how can we work as a chaplain that's not something that's physically mandated to be in a walled structure, 9 to 5, 12 to 8, 12 to 12, but that is something that we can respond to life's traumas and be there when and how and with ourselves as that's needed in the wider world. So that's kind of setting the stage of what we want to talk about. And as Carrie gave you my quick background of why I'm here and why I'm talking about this, I want to give you a little bit more detail just to give you an idea of, again, who I am and why I'm talking about this subject. So yes, I have been ordained by a wonderful organization called the Chaplaincy Institute. And I do have a Master's of Divinity degree. Right now, I am working as a chaplain resident for a trauma rehabilitation center, and that's something that not everybody really fully understands what that means. This is a rehabilitation center that has victims of acute trauma, meaning sometimes multiple injuries, strokes, head traumas, amputations, various things that have combined to make this recovery something that is more than what you might normally see as an outpatient recovery. What that does is that means I have the pleasure of being able to speak with people on a regular basis. The average stay is about 2 weeks. I have patients that I've been working with for 3 months. And this differs a little bit from my first experience in terms of my clinical pastoral education, where I worked with victims in the emergency department. So very much immediate traumas that were coming in that were in many cases life or death situations. Over the years, I've worked for multiple victim advocates and trauma groups. The one most recently that I'm most proud of is an organization called the Trauma Intervention Program, or TIP. It's something that was actually developed in Southern Orange County. And it's a group that really gets dispatched by police, by fire, by medical, 24/7 to be with the victims of immediate trauma. Most often it's a death in the family, a death at a hospital, a death at the bedside, a death at the roadside. And in being part of that organization and meeting multiple chaplains, I have found multiple chaplains that have thrived in these situations and multiple chaplains that have not. And it is a very particular calling, something that you really need to be present in the moment to be able to be there for the trauma, the visual, the sounds, the sights, the smells, but still be there and be present with those people as they need you at that time. And over the years, and we'll talk about that a little bit more, I've tried to really understand, working from an organization such as this to adding the spiritual element that comes within a chaplaincy focus. What is out there now? Is there such a thing as a trauma chaplain? So that's what we're going to talk about first, is really, what is trauma? And I went to probably one of the first definitions I could think of, which was the American Psychological Association, that defines trauma as an emotional response to a terrible event like an accident, a rape, a natural disaster. And then immediately after the event, the shock and denial are typical. And that's just two of the multiple types of physiological, emotional, and spiritual things that can happen to a person, either that have been part of that trauma, such as being part of that accident, or simply just witnessing it. And traumas can really run the gamut to, again, I just saw this happen, to a death of a pet, to a death of a family member, to being part of a group that maybe is being impacted by global challenges and crises that are happening to us right now. There are many people that are being significantly traumatized by things that are happening in the Middle East right now. These are all things that are happening to us and that are being impacted by outside events and outside forces. And while I think that just about every chaplain that I've met has the heart to be part of this and to understand that trauma is where we work, trauma is where we operate, but that trauma also takes on a bit more of an urgency when you can be there when it happens. Most chaplains are within organizations, be it a hospital, prison settings, commercial settings, where even within the emergency department, that's still a secondary. This is after that initial trauma has been dealt with, at least to the point of being able to pull that person, drive that person, transport that person into a point of medical care. And oftentimes, when we're working as a chaplain in these settings, that point of initial medical care is that person individually. You may have a family coming later on, a family that's meeting that person there, but that separates the shock and trauma between the victim and the secondary victims. So what I want to talk about is, how do we look at that type of trauma? The ones that, again, are outside of those four walls of immediate care. And how do we approach that from a chaplaincy point of view? So now that we've defined trauma, let's define chaplain. That's the second half. Now, trauma was defined in a pretty straightforward way. I think almost all of us would agree to that definition of trauma. Trauma is something we've experienced. Trauma is something that we've witnessed, and something that happens to us on a psychological, spiritual, physiological manner. How do we define a chaplain? Multiple different ways. One I pulled from Webster's Dictionary. Chaplain is a member of clergy attached to a private chapel, an institution, a ship, a branch of the armed services, and it goes on and on and on and on. A Christian official, again, chaplaincy comes from a Christian definition, who is responsible for the religious needs of an organization, such as a hospital, a prison. So far, we've not really mentioned anything outside the walls of an institution, a ship, a chapel. Chaplains are also members of clergy who can organize and lead religious services, but usually in a location other than a church. This is the first definition we've had from other than a church. They provide spiritual guidance, assistance to people who may be detained, incarcerated, hospitalized. That definition was from Indeed.com, describing what the role and the job role of a chaplain would be. I found that one of the best definitions. Fascinating. So here's something that I want to ask to everybody there. How do you define a chaplain? What's a chaplain to you? Don't be shy. Those of you that are in ChI should be able to define this pretty quickly, I hope.
If I may, this is Gardner here. I appreciate you bringing up the definition and the history of chaplaincy. I, too, was a hospice chaplain some many years ago. In my role now with adjudicated youth, I am also a chaplain. And one of the things that I find out with the benefit of being a chaplain is we are there to encourage, if I may, the client to be his or her best in the moniker that they define and describe their existence to be. And the chaplain has the versatility of encouraging that, inspiring that without proselytizing. And that's a position that I love.
Thank you, Mark. I like especially the last definition of not proselytizing. It's meeting them where they are and where they need.
Yes. Thank you.
Thank you, Mark. Anybody else? Any other thoughts on what you would define a chaplain as being?
There's a comment in the chat I'll share from Liza. I think of chaplains as people who assist others in finding and following their own spiritual path.
Yeah. And especially if that spiritual path is something that can assist them in a time of trauma. Yeah. Absolutely. Fantastic. Good definitions. And I think, oops, I'm going to go back one. And I also think that chaplaincy, too, is something that I think traditionally, and you look at the pictures here, the picture in the middle is what I think a lot of people, at least in the United States, think of as a chaplain, and that is the wizened older gentleman who has spent his years accumulating the cumulative wisdom of the faith tradition in which he represents, leaning by the bedside and helping that person transition. And while that absolutely is what a chaplain can be, a chaplain can also wear the hard hat next to the firefighter. The chaplain can also be the person that comes to your physical location when you are needed. So what I am encouraging everybody to think of today is to expand that definition of chaplaincy, not just in defining what a chaplain is, but defining what a chaplain does. And also, traditionally, when we're talking about chaplaincy and the outside of their four walls, I think that is also a place where we start looking at, but who, again, Mark, is the client? Who is the person we're talking to? Celia, I see a hand up.
Okay. Hi, Greg.
Hey, Celia.
I'm trying to manage the screen here. How are you?
Good.
Well, I'm actually more intrigued when you talk about outside the four wall. Because at this moment, that is something the world is not knowing how to define yet. Means that the stuff that you did on the street at 2 a.m., there is an accident, and you went out there, carry a bag. That's something that the society is not sure how to define. Is that still chaplain? You see, this is got to, I really get very intrigued by that. At that moment, as chaplain it doesn't do much anything except being there. You know, you just need to be there and try not to be getting in the way of EMT and all the other people. And And if the person needs you there to do some praying, and that's fine, but most of the time you're holding their hands. That's about it. And often I see my role is counseling. It really just be there and letting them know that they have somebody here, so they're not all by themselves. And so I hope someday there is a career for chaplain that's outside of that wall. Right now, I don't see it. So I would love it for you to say a few words about that. Thank you.
Yes. And I did not pay her for this segue either. Yes, I think, and one of the things, and this is a term, particularly in hospital chaplaincy, that's used a lot, and that is saying what I did for this patient was provide them a ministry of presence. I have always loved that term, a ministry of presence. And I think that's something that we can apply anywhere we are. Yes, Carrie, in the grocery store line, it doesn't matter where you are. The ministry of presence is what you carry with you and what you provide to those people in need. And so, yes, Celia, I thought exactly that same kind of thing. What could a trauma chaplain be? And the easiest definition is taking the prior two definitions. And that is a member of clergy who is focused on working with victims of immediate trauma. What is trauma? Trauma is an emotional response to a terrible event, and then dealing with what happens after that event. That's it. That's the simple definition. That's what a trauma chaplain can be. Now, being that is one thing, and now we come to the practical part of that. And let me ask you, does that make sense to everybody? I mean, when I'm trying to define what a trauma chaplain can be, I'm simply saying is whatever you define yourself as in your chaplaincy, and you are then focusing that chaplaincy on supporting the impacts of trauma. It sounds really easy and a very quick definition. Does anybody disagree with that definition? Is there something we need to expand to add to this?
Okay. Sacred listening comes in the chat.
Yes. So what then is this new? Is this the idea of trauma chaplaincy new? Do we do it? Who does it? What does it look like? There are so many organizations right now, and I am really heartened to say more and more every day that are attempting to bring chaplaincy into organizational structures, first responding structures that are specifically put in place to try to address this need we're identifying. And I'll send you, actually, I'll send some links, but I put some here that are just interesting ones that I came across. And let's see. Yes, you should be able to see these. There are a couple. This is one called the Chaplaincy Credential Providing Relief in Crisis. Now, this one I thought was really interesting, International Fellowship of Chaplains, and I don't know whether anybody belongs to these organizations. This is an organization, and I'm casting no aspersions whatsoever to the work they do, but one of the challenges that we see here in terms of who they are is it is extremely focused on one aspect of religious faith traditions. And this sometimes can be challenging, and I hope I'm not offending anybody. That's not my intent. But to say that a lot of times when we're looking for chaplaincy that is operating in something that is outside the four walls, and Mark, you said this, there is an aspect of evangelical or evangelizing in doing that. It's just a simple fact. This is one of the challenges to the nomenclature of trauma ministry. It is very focused on a Christian aspect. Chaplaincy, again, comes from a Christian definition. Therefore, it's not really surprising that this is something that's a focus. Now, that is one aspect. Go back up. Another one, and these are just ones that I thought were really interesting. This one was the Civilian Air Patrol, which is a quasi-governmental organization that has an entire chaplain wing to it. Again, who knew? This is something that focuses specifically on what is the role of a chaplain. And this is a group, the Civil Air Patrol. They're a U.S. Air Force auxiliary unit. They actually bring chaplains to the U.S. Air Force in different aspects of the U.S. Air Force. Again, quasi-governmental. This one is specifically, even in their statement, they say it is an interfaith organization. It's specifically tailored to being a chaplain and not bringing that with you. First responders. This is something I thought was really amazing, and I'm pulling one from Los Angeles because I know people within this organization. You have chaplains within just about every first responding organization. The challenge here is, particularly within police and fire, a lot of times the chaplaincy is focused, and this is not, I would rephrase that, it's not a challenge, it's an opportunity, to work specifically with members of the fire and police. But you're not normally externally focused to victims of trauma as well. So there are all kinds of things, and maybe some of you have heard of this. This is an amazing organization, the San Francisco Night Ministry. This is a ministry that they actually go out to the streets. And it's not, again, about proselytizing. To reach the most broken souls, you have to go to them directly. And this is an organization that actually teaches clinical pastoral education units as well. It teaches chaplaincy. So yes, there are organizations out there that do this. They exist. My question is, though, is this what we want it to be? So I've talked about what trauma I see as being trauma chaplaincy. We've defined trauma. We've defined what a chaplain can be. We've defined what a trauma chaplain could be by focus of definition. We've even talked about people and organizations that are doing this now. This is where my vision comes in, and this is what I wanted to share with you, of what could an ideal version of this be. To me, again, these organizations are one, and I'm going to be completely blunt with you. One of the biggest challenges of trauma ministry is I would like to be able to feed myself. I would like to actually be able to earn a living doing this. I'm just being honest. This is something that stirs my soul, that stirs my spirit, that stirs my passion. This is something that I have thought about for a decade, of how we can do this, because I see the need there. I see the need for a chaplain to be on call 24/7, that when an accident happens in your neighborhood, when there is a person that's dying and they're at home on hospice, they may not be covered by a hospice chaplain. Maybe police or fire or any organization that wants to contract with this organization to say, not only do I want somebody there that has the emotional coverage, I want somebody that can also provide that spiritual aspect, particularly either in the last moments of this person's lives or in the terrible, terrible result of the fact that I just witnessed my loved one passing, sometimes horrifically. And does my faith bring me through that dark couple of hours between here and there? The challenge is, how do we do that? We have to have an organizational structure that allows us to have responsibility. We have to have an organization that would like to say, yes, you know what? I swear and affirm that these chaplains know what they're doing. And that if they don't know what they're doing, here's who you call and tell that they don't know what they're doing. You have to have oversight of who's doing this, where they're doing it. And then you have to have either the volunteers or the paid people that want to do this as well. And they have to be willing to do this on an interfaith basis, not bringing their own baggage with them. So to me, an idealized design has all of these things with it. And yes, shameless plug, yes, I would love Chaplaincy Institute to, and I'm not bringing this up specifically for that. There are lots of organizations out there that would love the opportunity to hold this together. But what I am saying is that until we, and this is something all of us need to do, we need to talk about this. We need to say, this is something we need. This is something that everyone could benefit from. And this is include not the spiritual, but not religious. I'm not religious at all, but you know what? Right now, I need something because there's no way I'm going to sleep tonight knowing what I just know, knowing what I know and seeing what I just saw. In a moment of solace and comfort, as Celia said, being there for them, being that ministry of presence. But being at the roadside. And as Celia said, I within the organizations that I volunteered before, I did a very quick calculation the other day and said, I've probably been in the presence of 150 bodies in the last 10 years. And with those bodies comes multiple grieving families. And yes, I've been there at the bedside and it's been wonderful. I've been there in the hospitals where I'm watching them turn off the ventilator for the last time. And I've watched them cover the bodies in the streets. And they all carry the same weight. They all carry the same trauma. But being able to stand next to that person on the roadside, putting a blanket around their shoulders, staring them in the eye saying, we can get through this. And I'm here for you. Means so much to that person. There's no price for that. So what I want to ask you in your questions is, how do we do that? How do we talk to people? How do we say, hey, this is something I think we need to do. How do we do it together? And how do we make sure this is something we can continue to offer to somebody on a long-term basis with the core responsibilities, the core skills, the core oversight that we need to do this? So that's my question to all of you. How do we do this? Do you agree that it's something we need to do? Do you agree that it's something that would be interested in exploring? So that's my question to you is, we've defined it. I've defined what it looks like in my mind. I've defined what I think it could be. And that kind of leads to the next question, which is, what do you think? So thank you for that. And I have no idea what time it is, Carrie, so hopefully.
No, that time. I'm going to ask you to stop share, maybe, Greg, so that we can see each other a little bit better. And yeah. Ask the question again. Okay, yeah. And it's probably multiple ones, but the biggest one in my mind really is, does what I described seemed like something that you feel is needed? If you feel it's needed, how do we talk about it? And if we can talk about it, how do we make it happen?
I would like to add that chaplaincy is, I would say, desperately needed. It has a power to interconnect with multiple groups, just as a shepherd of comfort, a contact of compassion. And one of the things that I love, just 2 days ago, I was at my office and a representative from the Islamic community and I sat down and talked at length. And we've known each other for the past 2 to 3 years. And just the interchange of speaking the language of faith, yet respecting the doctrine of his community, my obligation as a state employee, in awareness of my own faith system, being able to just address similar issues with him from the son of Abraham perspective, and just as a state representative dealing with some behavioral issues within the adjudicated youth population, it was extremely connecting, Reverend. Extremely connected. So I think in a humble sense, we can replicate and multiply that essence of just human care and spiritual care, whatever it may be, for the populace, whether it's within 4 walls, said adjudicated youth, or outside the 4 walls, as Celia had mentioned. So I think it's definitely needed. The power and the potential is there, but it's going to take, I think, like a foundation like Chaplaincy Institute to be the pioneer in making that happen.
Thank you, Mark. I appreciate that. And I agree. I absolutely agree. A part of it is just being able to have those discussions and understanding it from all aspects.
Yes.
Thank you. Terry?
New buttons. Oh, just a logistical thing, which I guess is what you're asking about as well.
Yeah.
From my experience working as a counselor, it's just like once upon a time, chiropractic care was not covered by health insurance or Medicaid. I think that one of the things we need to do is create a presence and advocate to have chaplaincy services covered as they would counseling or other types of therapy by Medicaid and insurance. Otherwise, the likeliness of hospitals to pull that money out of their pockets or other institutions is just not likely. And I think as some systems get greedier and some people in some systems have less money, the odds on that are going to become less likely. So getting it covered by getting it, I don't know how that happens exactly, but I guess just again the same way that occupational therapists and chiropractors once did it, is somehow you lobby to the right people and get these things covered and considered a necessity. That way we can bill for it. Otherwise it'll continue to just be difficult. And maybe incorporating more of this, what do you call it, the not trauma care, but like the first aid. There's a term for some training you can take that's first aid mental. It's not, they don't call it first aid mental health, but maybe incorporating more in our chaplaincy programs, not just ChI, but all of them, more understanding of mental health diagnosis and trauma care, I think could be a big part of that, especially as we continue to have catastrophes in states, weather related and otherwise, that those things could be beneficial and good places to argue, our point and our place in the process.
That's a great thought, Terry. I completely agree. And I think what's one of the things that I've seen, particularly even in CPA education, is a move towards results-based verification of what you're doing as a chaplain, and trying to basically be able to defend and define what it is you're doing and what it is you're bringing to this patient population. And while I'm a bit resistant to that, because I think it's really hard to quantify how do you heal a spirit, I do think that that's part of what we need to do to get where you're talking about, Terry, is to say, yes, absolutely, this is what we do, for this population of person. And is that something that is of a value to you? And if we can put a value to it, then we can say, yes, then we need to find a way of funding that value. So very commercial attitude, but you're right. We need to find some way of being able to find that. Yeah.
From the chat and the practical, needing to get advocacy and legislation, it's difficult to show that if you are doing something right, that there are fewer outcomes. Just what you said, Greg. Prevention is always harder to prove than intervention.
Absolutely.
And then also results-based outcomes, something the Spiritual Care Association is working on.
Mm-hmm. And I absolutely have seen that in multiple, again, educational units. What we're discussing with that is how do we convert to at least some level of a results-based outcome to do that. And again, this is something that I think we have to test the labs within the four walls first to be able to show that, so that we can extrapolate that and say, if we can do this within a multidisciplinary unit of a hospital or association like that, and we know it works there, then if we were to bring that to outside of these walls into a more instantaneous process, wouldn't that be even better and show even more results? So yes, I think we need to do both. Yeah. That's good. I know that this is it's a little abstract in terms of a concept, but I don't think I've ever met anybody that I've talked this concept to that has said, what? No, we don't need anybody to go out into the street and talk to people that are there and hurting. I've never heard that level of resistance. It's always been yes and, or yes but. How do we do it, and who do we need, and who do we get there, and how do we make this happen? So I know I'm preaching to the choir, as they say. A lot of it is, how do we do it? Hey,
I want to lift up two people in our ChI community. One that you were ordained with, Greg, and graduated with, Reverend Charlotte Kramer, is working in street ministry and doing some fantastic stuff. Not within four walls necessarily, but of course there is an office and an organization that is associated with the work that she's doing. I think she's the only, there's two employees, but still, she's out in the street and in prisons, in jails. And then Reverend Anne-Marie Coletta, who founded Raising Sparks Ministry as her practicum while she was in school at ChI, and is out there doing really, really good work. So we're, little bits. And I think people who serve in mental health facilities, in recovery facilities, in rehab facilities, so lots of people we're on the forefront, as we always have been.
Mm-hmm.
I also want to invite, if anybody's got questions for Greg in particular, about anything else or about ChI, I'm here to answer those questions too. So if that's okay with you, Greg, we open the floor a little wider.
Please do. Yeah. Any questions, observations, thoughts at all?
The other thing that I find myself doing more is I'm working as the spiritual and bereavement coordinator for a small local hospice. And within that, we're in and out of a lot of assisted livings. Of course, it's not an inpatient hospice. We go to where the people are. So we're seeing them in their homes or in assisted livings, nursing homes and the like. Especially this time of year, the staff in those places are witnessing so many deaths. And I have been doing a lot of reaching out with the staff for, bereavement support, but it's essentially basic trauma. Like this may be their first death. They may have been the one that found them. It may or may not have been okay. We've had some where one of our patients died, but someone else in the home did. And they were very different experiences. And just needing to be present and aware of that kind of support too, because it's a secondary trauma, but that caregiver trauma is real.
Absolutely.
And I agree with you. Last year, I had ran a support group for first responders, and the subject is all about secondary trauma. And there are suicide rates. They quit because the numbers in the hospital is just too big. One nurse for every 6 patients, and it's just ridiculously high. So they couldn't deal with it anymore. So there's a moral stress, all kind of things that comes with in this industry. So we're not just talking about the patient, we're talking about the person who care for the patient. So.
Yeah, and I think that's what's really remarkable is what I've seen in terms of going back to the idea of outside the 4 walls, the organizations that have been really good about utilizing chaplaincy are police and fire, local cities that are hiring these chaplains to come in to take care of their caregivers, their first responders. There are organizations, and I talked about the organization CHIP that I belong to. There are organizations, particularly small municipalities and cities, that hire a chaplain to do those same roles, to go out and be with the firefighters and the EMTs, to be with those victims, to sit with them till the coroner comes, and to ensure that they have that next couple of hours, again, within that organization. To me, I think that's probably one of the closest kind of organizational structures that comes towards this trauma chaplaincy that's out there right now.
Okay, this is I'm not thinking all the way through, but tell me, was there a story about how being tended in the first few moments or hours after a trauma can prevent PTSD? Okay.
Yeah, I don't know. There are definitely a lot of studies where they've taken the concept of the golden hour, which is really where you need to be responded to in terms of medically, and extended that to the psychological and spiritual aspect of that as well. And that is, if you have those moments that you can just any level of intervention, any level of talking about it, any level of having somebody there that's simply tending to you and allowing you. When I was doing a lot of the volunteer, what I used to tell them was, I understand that your mind is gone. Your mind is not right here, and that's fine. I'm here to be your mind and your body and your spirit for a little while yours is gone, and just to be with you. And there are so many times where I would be with that person for hours and hours and hours until the coroners come and everything else, and you wouldn't even think that they recognized you were physically in the location with them until you're ready to leave, and they break down, thanking you so profusely for having been there, and sometimes citing things that you said that you had no idea you even said that. And to me, that was just so amazing. And so, yes, there is that idea that the golden hour is extended to spiritually and psychologically as well, in terms of preventing longer term secondary trauma. Renovos talks about that, and the body keeps the score. Yes, absolutely. And there is a whole lot of documentation and data out there in terms of how to talk to children about trauma. And the fact that, you know, not telling them things, keeping from things, or saying something that is using euphemisms for other things is not necessarily the best way to tell a child about a trauma. Being honest with them is the best way of telling them what happened. Yes, very much so. Trailer for a beautiful film called The Wisdom of Trauma. Ooh, okay, thanks, Deb. Want to watch that now.
Is that with Gabor Mate, Deb? Oh, it might be.
Sorry, yes, it is.
Thank you. A researcher on trauma, Holocaust survivor, fantastic Canadian physician. Childhood in Hungary. Yeah, really fabulous. I'm just going to tell the story of one of our clergy who was hit by a car, not a real fast car, but a pretty big hit, and did not open her eyes from the time she was hit until she was in the ambulance. But somebody was with her, holding her hand, telling her what was happening, telling her she was going to be okay. And she kind of credits that person as her angel, as keeping her in the moment and preventing it from being a much bigger emotional, spiritual experience than, I mean, it was still big, but yeah, so we've heard those stories. We've experienced them from our side, many of us in different pieces of work that we've done or training that we've done. But yeah, that was really something for me to hear from her side.
Mm-hmm.
Yeah. What other questions do you have, friends? Things you want to share? Oh, Deb. I'm sorry, Deb, do you want to say something, or did you just hop on my screen? Okay. All right.
So, Terry, I see your hand.
I was just going to share, this doesn't maybe apply for all situations, but in one of my last jobs, so I work in substance abuse, and the place I work now, my title is just counselor, but in the last place I worked, a place called Valley Hope, and there's not a lot of places like that, but they intentionally hired chaplains to assist. Well, one, most recovery is considered to need a spiritual component to it. 12 Steps is a spiritual-based program for those who use it, but because of confidentiality. So I could have conversations and people could share things with me. So I would hear people frequently what's called just their fifth step, which is where they write down things they've done in their addiction or just in their lives in general that they need to share and let go of so they can move on. And Valley Hope, that particular treatment center, was caring enough and smart enough to hire chaplains for these roles so people could feel safer about sharing whatever it was that was on their heart and minds. And unless they had, every state has their particular things. Like if someone said they were going to go out and hurt a child, any kind of immediate harm to children was off the table. Just about anything else. They could tell me about any crimes they've committed, things like that. And I didn't have to chart those, and they could not call me to court to testify for that either. So just another, I think, sort of unique way. Different states have different rules about these things, but another unique way that chaplains can create a sense of safety for folks who need to unburden in certain situations.
It's an excellent point. And that's extremely important when you're working with people that are in the midst of trauma, who may be talking about things that they don't necessarily need to be talking about in that point in time, for even legal reasons. And to be able to be a safe space for them to kind of gather their thoughts while they're going through this process is an extremely important aspect of this. Yeah. Thanks, Terry. Yeah.
I'm going to pull focus. How about any questions about the Chaplaincy Institute? Anything that I'm not sure if there are folks here, there are names I don't recognize, but anyone want to know about how our programs work? Or I'm looking around here. I think it's mostly people who've been around.
I have been a periodic visitor.
Yeah, I recognize you.
For, some of the town halls. I'm sorry, open houses, and it's the rhythm in my life now is getting to a point where I can take maybe 2 certificate courses throughout 24. I was speaking with my wife about it the other day, and she's very much in support of it. So I'm looking in 2024. I think I came across social justice, and I think it's interreligious, a few of the world faith traditions. I
Yeah.
think one of the sessions starts in January and the other maybe in March or May.
Yeah.
So wish me well. Hopefully I can activate both of them.
That's how a lot of us start, Mark. I'm telling you. That's how
I'm sorry?
finish too.
I'm sorry?
Onesie twosies, the courses, that's how a lot of us start and how a lot of us have finished. So
Thank you. Thank you.
You're
for
right
that.
in the middle of it.
Yeah. I'll just say Sacred Justice Ministry is February 2nd through 4th. Beautiful course. And Global Spiritual Traditions 2 is March 22nd through 24th.
Yes. Okay.
So, and I know people in this room here have taken those courses, and yeah.
Excellent.
Great stuff. Great stuff. Carolyn, let's hear from you.
Yes. I am interested in learning more about the Institute and that path that you're describing. But before we go there, I just wanted to say, Gregory, that, I completely recognize the value of what you're proposing. And I am in a very early explorative phase. This is the first time that I've participated in a ChI session, so I don't have answers for you. I just appreciate the conversation and the service that you're providing and that you're promoting. And so I was trying to decide what are my questions, but since Mark started us there, I would like to understand a little bit more about that path of taking a class here or there, and then how that might progress toward ordination, because I recognize that I'm just not in a position to commit entirely at this moment. So if someone could describe that for me, that would be really helpful.
Absolutely.
I'm going to invite people to jump in if that's okay. I'm the community minister, so I hold kind of the community side of things, and my colleagues on the admissions and seminary side are out this week or busy. So I said, I got it, because I knew that there would be a group here. So I'm going to put in the chat a place to talk to somebody who knows more about this than I do. But a really great way to start is the onesies and twosies. You can take 3 electives or 3 courses without being enrolled before we ask you to consider that. Well, we ask you to enroll. So you could take one and then a few months later take another one. I think, Robin, do you want to speak to how that worked for you? Is that
that's how I started. I started by taking one open course, and I fell in love with it, and then I figured out how to make it work. And here I am a year and a half later, writing my core competency self-evaluation so I can be ordained in the spring. And holy cow. And I'm just kind of laughing at Greg with his double thumbs up there, because he was in that first class that I took. And he's the one.
So proud of you.
Yeah, he was the one who at the end of it, I said, okay, that's it. I'm enrolling. And he hooted and hollered, and that was kind of nice. But yeah, you can start that way, and it's addicting. That's my warning.
Yeah.
Hey, Carolyn, I have to tell you, you look at the class, you look at the description, if it speaks to you, jump in.
Mm-hmm.
And don't worry about where you're going with it. I'm a learning junkie, okay? I'm 73 years old, I'm still here. So you could always learn something new. And then if at some point in time, like Buddhists always say, the plan will show up in front of you. You may not start with a plan, but somewhere in time you got to know. But right now, if you have a curiosity and your heart speaks to you about that, jump in, learn something. The biggest learning I got out of ChI is all the fellow students. They're fabulous. They ask the great questions. And this is how we get stimulated as adult learners. That's my 2 cents.
Thank you, Celia.
I am not enrolled yet, but I am trying to get all of my ducks in a financial row because that's where I'm at with things. And I am hopeful, but it's not there yet. But I know I went through one of the open houses and asked, I don't know, 400,000 questions, give or take, and then was emailing back and forth, getting more information after that. And I know that that was very helpful for me as far as, getting I was talking to Katrina and we were able to kind of talk through a few things and really kind of get me a plan for even how to start. So if you haven't had the opportunity to go to one of those, then I would encourage you to do that because they tell you all the nuts and bolts and things, but then you can ask all of your personal questions too.
Thank you, Liza. I'll put all of those links, or I'll ask our beloved work study student to put all of those links in the email that comes out. We send a follow-up email, and I'll ask Greg for all of those links, and we'll send a recording of the video and open house links and a way to get in touch with admissions. So if you're here, I have your email address, and so you will be on that list. But I also want to say, don't hesitate to set up a time to meet with me or to meet with the Dean of Students, Reverend Katrina Leathers, or our admissions specialist, Michelle Gantz, because the best part of our day really, really is when we are sitting down with a student or a potential student or a clergy member. That we do a lot of database and la, 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 la. And the best thing that happens is when we get to be on Zoom with you. So please never, never, never hesitate. We are beyond our time because we were having so much fun. So I'd like to invite us all to thank Greg. Thank you, Greg. Really, really appreciate it. Really, really appreciate it. Appreciate you. And thank you so much for coming, beloved people. I'm so glad that you're here. I'm so lucky to be in community with so many of you, and I look forward to being in community with the rest of you. So blessed Thanksgiving. Big love to everybody, and I hope to see you in the classroom or in a ChI talk or an open house real soon.
Thank you.
So much,
Thank
everyone.
you. Thank you. So lovely.
Thanks.